Do you ever wonder why calling the doctor feels so intimidating early on in your career? I remember being so intimidated to call the doctor. Like, I needed something, I knew I needed something, I knew pretty much what I needed, but I was like a bit intimidated to call. So, if you've ever stared at the phone and just dreaded making the call, I'm very lucky. I work somewhere now where calling the doctor is completely welcome and encouraged, but I know not everybody is that lucky. And I certainly know even early on in my career, even though I could speak freely to the doctors, I was still intimidated. So how do you get over that fear, right? How do you make yourself feel better about that? So the good news is that you can plan for it and it can get easier. So what are you worried about? Why don't you want to call? Are you afraid that you'll sound stupid? Are you afraid that you'll forget something? What are you afraid of? What part of calling the doctor scares you? Are you afraid that they'll yell at you, that they won't take your feedback? So we need to think about what is it that scares you, because we need to understand that first. But also, regardless of what it is, if we make a plan, make a checklist, then we can get through that. So if we think to ourselves, okay, first of all, I'm not calling because I know everything. I'm actually calling because I know I don't know something, and or I know I need something that I can't give the patient. I need an order for something. I need somebody to come and assess the patient that hasn't already seen the patient. I need another set of eyes. So you're part of the team, right? You don't have to know everything. And so you're calling a doctor for help. That's why you're calling. So shift your mindset a bit. You're not calling to say, I know everything, I know what's wrong, please do this. You're calling to say, something is happening with my patient and I need additional support. So that's part one. Then part two, before you come pick up the phone, you have to do your homework. So say to yourself, what is happening? What is happening with my patient that makes me feel like I need to call the doctor? So start with one sentence. My patient's oxygen saturation is decreasing. Great. So let's think about why you're concerned about that. So what does that mean to you? So the oxygen saturation is decreasing. So my patient isn't getting enough oxygen. Is this a breathing issue? Is this a circulation issue? What does my patient look like? So what does that mean? I have to have assessed my patient. Every time our patient's vitals change, whether they're changing because we're in the room and doing a set of vital signs and we see that, or our patient is being monitored and we see a change in their vital signs, the patient is telling you that you need to go in and assess them. Making sure, okay, the oxygen saturation is decreasing. Have I changed the probe to a different finger? Have I assessed the patient's chest? Do I see any other changes? What do the nail beds look like? What color are they? So those are the sorts of things that you need to have on hand. You learned in school and you learned from nursing what a decreasing oxygen sat indicates. So what are the associated assessment findings and which ones of those does your patient have? So that's the first piece that you need to have. So have your current vital signs ready. Have your current assessment findings ready. Have your previous vital signs ready. So what were they before? What interventions have you done so far? Did you sit the patient up? Did you apply oxygen? What have you done? Did you administer any PRNs that were already ordered, et cetera, et cetera? So what have you done as interventions so far? If this is a brand new patient, there are no interventions for oxygen saturation, that's okay too. You can say there are no PRNs to be provided. What medications are the patient on? What allergies does the patient have? Because you don't want the doctor putting in an order and then saying, oh, the patient's allergic to that. I forgot. So those are some of your things. If the intake and output is relevant, right? If your patient is a leader in positive balance, like, is that a cause for their decreasing oxygen saturation? Are they having heart failure? That could be relevant. So what are the recent ins and out? And then, of course, have all those things kind of ready, right? So now you've already reviewed the chart. You have all your assessment findings ready. Keep that chart open and now make your call. And make sure that when you're talking to the doctor, you tell them who you are and specifically which patient you're talking about, right? So, hi, my name's Rachel. I'm calling about the patient in 312 Frederick. his oxygen saturation has decreased from 94 to 89. We have applied oxygen. We started at 2 liters. We're now at 6 liters, and we're still not getting the patient above 90. We've spoken to the RT. The patient doesn't seem to be in any respiratory distress. The chest seems unchanged from previous, but the cap refill is a bit sluggish at this time. Blood pressures and peripheral pulses are still normal. Okay, so this is where you want to go. And think about this as the S-bar, right? So you learn how to write an S-bar early in school. So that S-bar technique is typically how we write any of our communication things. And so you want to think about presenting the patient as the S-bar. The doctor you're calling may not have seen this patient yet. This might be the on-call doctor, not the admitting doctor, especially on overnights. So you might be calling somebody who has never seen or heard of this patient before. So you need to really give them an S-bar. What's the patient here for? Why were they admitted? Because they may not have that information. So before you call, you have all your assessment findings, get your S-bar sort of in your head ready. You don't have to be super formal about it, but generally have that S-bar ready so that if they don't know the patient, you can say, I'm calling about this patient. Are you familiar with this patient? If they go, yes, I know them well, then you can just go into your assessment findings. If they're like, no, I'm not, then of course you need to do your situation and background. So then once you give them all that information, they may have questions for you. And if you don't know the answer to the question, don't fake it. This is your patient. You're an advocate for your patient. Don't make stuff up. Tell the doctor, I'm so sorry, I don't have that information, or I'm not sure of that information, or I didn't assess that when I saw them. Would you like me to go and do that now and call you back? Or do you want to come up and see them? And in the meantime, I will make that assessment, et cetera, okay? So if they ask you a question you don't know the answer, just be honest. It's okay that you don't know the answer. As long as you came generally prepared, nobody's going to have every answer. So it's fine. And then the last thing you want to do before you hang up is make sure that you're clear on the plan. Okay, so you're going to enter orders for PRN, Ventolin for this patient. Then you are also going to enter orders for a chest x-ray. And then you are going to come and assess the patient in about 30 minutes. So you're repeating back what they've said so that you and the doctor are very clear on what orders you're expecting and what you're expecting to do. So I hope that makes sense. Now you're going to document it all, of course. You're going to do the interventions, you're going to document the phone call with the physician, you're going to document the interventions, and then of course you're going to document any follow-up or any improvement or lack thereof, recall to the doctor, etc. The goal for this isn't to not feel nervous when you call. Sometimes you're just going to feel nervous. The goal is to go in prepared and know that the reason you're calling is because you know that something is happening with your patient. You know you have to do something about it, and you're calling another team member to help you. Hope that helps.